Hi, I'm Dr. Ross Pacini. I'm a cardiologist at Bryan Heart. I grew up in Grand Junction, Colorado. It's on the western side of the state, close to Utah. Graduated high school there and then went to college at Colorado State, go Rams. And then from there went to Creighton University over in Omaha, so go Blue Jays. And then I did my internal medicine residency at Emory University in Atlanta, Georgia. And then went up to Chicago, Illinois at Loyola University and did cardiology fellowship there. I swore I wouldn't be a doctor, and then my father is a cardiologist, so I swore once I gave in to being a doctor, I swore I definitely wouldn't be a cardiologist. And I just found myself gravitating towards all the cardiac subjects. So when we did pharmacology and we would talk about cardiac medicines, I memorized those better. And when we started seeing cardiac patients, I realized, gosh, I really like these people. Despite my best efforts to avoid being a cardiologist, that's what I ended up really liking the most. I really enjoy my time with patients more than almost anything else. I like them to get to know me, actually, and I use a lot of anecdotes and stories from my own life and other people I've had so that patients can kind of relate to that. One of the nice things about cardiology is there's so much we can do for patients now that most people actually have a pretty good prognosis. And even though the heart sounds scary and everybody gets very nervous about heart disease, I spend a lot of time trying to reassure people that, hey, you're going to be okay. And most folks actually do very, very well in cardiology. The field's always expanding, and if I had to pick particular things I like, aortic stenosis, narrowing of the aortic valve, preventive cardiology, so people who are sort of the worried well, that are very nervous they're going to have a problem, or they have a family history of heart disease, and they want some reassurance or want to know what they can do to lower their risk. I really, really enjoy that aspect of it. I am boarded in nuclear cardiology and echocardiography, so I certainly enjoy the imaging aspects of cardiology and viewing the heart that way. The other nice thing about cardiology is it's a constantly evolving field because it is the #1 killer. People do come in so sick and most of the time do so well. It is an incredibly rewarding field to be in.